I'm Dr. Tracy Oster, and I'm the Military Sexual Trauma Coordinator at the South Texas Veterans Healthcare System.
I'm Dr. Betsy Davis. I'm the Local Recovery Coordinator here at the South Texas VA.
April is Sexual Assault Awareness Month. We wanted to come together and start a video series called What to Expect at VA to try to demystify and talk more about what the programs are that you may want to participate in at VA. So over the next 2 months, you're going to hear a number of topics and videos related to mental health. Our topic today is what to expect when you endorse military sexual trauma, or MST, as we will refer to it in this video. This is a very sensitive topic, so if you feel like this is not the right time to listen, please move on now. Military sexual trauma is the term that VA uses to define any type of sexual assault or repeated sexual harassment that somebody experiences during their military service. 1 in 3 women and 1 in 50 men report that they have experienced MST to their VA providers, which describes just how important this is for us to be talking about out loud and really learning about the options for treatment.
So Dr. Oster, if someone wanted to report that they experienced military sexual trauma and wanted to learn about some of the care options here at the VA, who would they start with? Who would they tell?
So there's no wrong answer to this, and there's a lot of different options. So you can tell somebody on your primary care team, which means that when you're in the clinic, you could tell your doctor, you could tell a nurse, you could tell a provider that you already trust at VA, and they will help move forward to getting you the services that you need.
Awesome. And so when you're in that appointment and you share that information, you disclose that military sexual trauma experience, what can you expect to happen next in that appointment?
So usually what will happen is that the provider will ask you 2 screening questions about whether or not you've experienced sexual assault or you've experienced sexual harassment. And at that point, what will happen is that they will put this in your medical chart. You do have the option to say, I don't want to answer, of course. But if you do endorse this, then they will put it in your medical chart and a box will show up in your medical chart that will indicate that you've endorsed military sexual trauma. This is really helpful because it indicates to providers to be sensitive surrounding topics related to trauma. And also, it helps to move forward eligibility because at VA, if you endorse MST, a lot of the time you are eligible to receive free health care related to military sexual trauma throughout your lifetime.
Awesome.
Dr. Davis, I'd like to ask a question about services outside of VA. So a lot of times a veteran would be interested potentially in getting mental health treatment at VA. And once they have endorsed to this provider, the provider will then put in a referral for them to meet with the first available mental health professional. And we're going to talk a little bit more about that as the videos go on. Mm-hmm. But say they endorse military sexual trauma and maybe they want different types of treatment or they're just not interested in mental health treatment at VA. Are there options in the community?
Yeah, absolutely. We have a lot of community partners who also work with veterans who have experienced military sexual trauma. So one of the options that is kind of under the umbrella of the VA but is separate from our VA medical centers are called vet centers. So these are smaller counseling centers that provide services to kind of a subset of veterans, including veterans who have endorsed military sexual trauma. And so we are lucky to have 2 of those in San Antonio, and you can find more information at vetcenter.va.gov. We also have some other community partners who are great resources. So the nonprofit Endeavors has a number of veteran programs, some of which have specific groups for military sexual trauma. And then there are some nonprofits and advocacy groups like Circle of Arms, or some specifically for women veterans like the Pink Berets and Grace After Fire. There's a whole list. There's a whole plethora of them that are available locally. I think you have a list of them. If people reach out to you, you can help them get connected.
Very nice. So I hope that that helps start this conversation, as well as help you learn a little bit more about what it looks like at the start when you endorse MST. There are many different mental health options if you're interested in seeking them over here at VA. And there are multiple different clinics with specialists who know how to work with veterans in a sensitive way related to this very sensitive topic. You will see also my contact information, and you can contact me. And I am also happy to get that process started with you. And we'll talk a little bit more about what those programs and what mental health looks like in a few of our other videos.